Good morning, everyone, and thank you all for being here today. We signed 4 bills that addressed health and wellness here in the state of Rhode Island. And the last 18 months have presented some of the greatest health challenges of our lifetime. Out of that, we've seen our local leaders find meaningful moments to advocate for what Rhode Islanders need most. Today, those leaders have made Rhode Island the first state in the nation to pilot a program for harm reduction centers to help combat opioid crisis. So congratulations to our leadership here and to the advocates that have been so instrumental in terms of addressing this issue. Today we address the opioid epidemic by creating penalties for what is deemed improper opioid prescription writing. And today we make a resource that was a lifeline to so many of us during the pandemic, telemedicine, more accessible by requiring all Rhode Island Medicaid programs to cover the cost of those visits. All this progress doesn't happen without dedication of our partners in the legislature. So I want to really personally thank our Speaker, Joe Sacacci, along with our Senate President, for their leadership and for their members of the respective houses, the House and the Senate, for their leadership as well. And I want to acknowledge all of the bill sponsors who worked so hard to pass legislation that improves access to services, promotes wellness, and makes healthcare here in the Ocean State more inclusive and more innovative. So thank you to Senator Josh Miller, Representative Jay Edwards, Representative Deborah Falella, and also Representative Stephen Casey. So thank you to all. Along with Secretary Wamsana Jones, who is a champion as well. Thank you so much, Secretary. We also have a strong team of advocates here today, and many of whom make up the backbone of our robust health infrastructure in the state of Rhode Island. So I'd like to just say a few thank yous. One to Bob Haffey, President of Kent Hospital, Mary Moran, President COO of Butler Hospital, Cliff Cabral, Horizon Healthcare, CEO Jean LaChance, President CEO of Thundermist, along with Annabeth Moya Bell, who is a strong advocate in this work. So thank you all to the advocates here. With that, I want to just thank everybody for their efforts and look forward to making these bills a reality in the planning process that's coming ahead for all of us, and to making sure that we follow through on the leadership that has been given by the General Assembly to make these a reality to help the people in the state of Rhode Island deal with many of these health and wellness issues that we know are really important.